Hello everybody and welcome to Get to Know Your Body's Aches and Pains. So here's a question for you. Do you experience elbow pain? Do you experience wrist pain? Forearm pain in general, basically anything to do with your arms, hands, and elbow in here. If you do, you may have tennis elbow or golfer's elbow. So basically, you don't need to be a tennis player or a golfer to obtain these types of injuries. You can get these types of repetitive strain injuries due to typing, painting, climbing, being a massage therapist, anything that's repetitively doing extension, overuse, or flexion, okay? So basically what this means is that you're gonna feel pain in the elbow, so lateral epicondylitis, also known as tennis elbow, medial epicondylitis, also known as golfer's elbow, and you'd get pain in the wrist. You would also have troubles writing, picking up things, gripping things, even picking up something easy as like just a coffee mug. Any kind of regular work that you do, you wouldn't be able to do that, or you would have a lot of pain trying to achieve your accomplishments. So basically, now we're going to continue on to the rest. So if you have arms, continue watching. So basically, what happens is that when we're repetitively using our muscles join, they join into a tendon. So, and then the tendon is attached to the bone that creates an action. Sorry, so basically, when we're overusing these muscles, we're creating trigger points, scar tissue, adhesions, all of these things start to develop, and they develop quietly. So you don't know that it's happening until one day your body's just saying, I've had enough, and you start to get pain and you can't do your job anymore. So you go to the doctor gives you a brace, or they don't really do much of anything, send you to a whole bunch of tests. Sometimes they're helpful. The people that you need to actually see are chiropractors, physiotherapists, massage therapists, trigger point therapists. We are the ones who are going to actually be able to do some treatments with you without having to pop that pill or have the run around seeing different specialists. But still, if you need to see a doctor, see a doctor. Basically now, so lateral epicondylitis, as I said, is not just a tennis injury. So it has to do with constant extension of the forearm muscle. So basically, and twisting. So basically, you're going to have pain in here. And so the tendon is going to be inflamed, filled with scar tissues. It's going to be, there won't be any pain at rest. So when you're doing your usual tasks, that's when it's going to start to bother you. So now if you're doing a lot of flexion, again, so this could be golfer's elbow or medial epicondylitis. So many big words here. Anyways, I'm trying to break it down. So basically, you're going to be feeling pain in these areas. So it's repetitive flexion. Anyway, so now I have these tools. So as I had these injuries, and it's very hard to find a trigger point therapist to help me out with this, I had to find my own way of healing myself because it affected both of my arms. So this tool here, it's part of a trigger point set. It was actually intended for the calf muscles. Okay, and it also came with these two balls and also a block to steady it. Okay, so now with these tools and also with the AccuBall Mini, we can use so many different things. I'm going to be showing you in the next video demos on how to treat your arms, whether you have tendonitis of the elbow, so tennis elbow, golfer's elbow, wrist pain, forearm pain, whatever that is. If you use your arms, you need to do these treatments. Basically, these things develop since childhood and they don't go away with regular massage. So proper treatments need to be done, and I will show you how to do that. But don't just take these treatments and just go ahead and treat yourself, okay? You still need to see a provider to actually give yourself a diagnosis. These videos and these demos are meant to be done with the advice of a professional. And it's to be done to actually maintain treatments, because I know that you can't have the time or the money to constantly be going in for like 10, 20 treatments, okay? So I'm gonna be showing you in the next video, in the demo, how to use this tool for your arms and these, okay? Till the next video, see ya.